have with seasonal flu. We tend to see them in the military being used overseas, and they're used because we don't want, for instance, our military personnel even having a sick day. If they're going to work, we want them on the front line, we want them to perform, we want them to protect your country. However, with this particular intramuscular vaccine, which is given in your deltoid in the arm, essentially what it's doing is saying, well, okay, if I had to protect one space in the house, because I couldn't protect all of the spaces in the house, which space would I want to protect the most? And the answer would be the bedroom. That's safe. So if you had to put soldiers into a space to protect a place, it would be that safe, your lungs. So essentially, a person may have the usual upper respiratory symptoms, the things that nag and bother you, but then you wouldn't go on to have the lower respiratory symptoms, the cough, the shortness of breath, the difficulty breathing, the loss of consciousness. All of these things that are telling you the body's now becoming overwhelmed. So you may get into the house, you may break into the house, you may take up some of the crackers from in the kitchen, you may even decide, depending upon the type of criminal that you have, you may decide to fry an egg. But certainly if you got into the bedroom and you saw a bouncer there or a guard there standing up, you might not get back out alive. And that is really the goal of the vaccine. Now, why is it important to vaccinate at this point in time? And I'll tell you why. Every single time the virus replicates, and it's not just this virus, it's any virus. And it also happens with human cells as well. Anytime a cell replicates or multiplies, whether it is as a result of damage that has occurred or simply to carry on the life cycle. And remember that the virus only has one goal, one single goal in mind, and that is to survive. To survive at all costs. To survive at all costs, even if it means harming you, even if it means killing you. That is the role of the virus, to survive at all costs. So you have this virus, essentially, and this virus can replicate or multiply, and every time that it multiplies, it will say, I wonder if I change probably my hair, and we go back to the thought process of a criminal, if I change my hair to a different color, would they be able to recognize me? If I took off my cap and I put on a different color cap, would they recognize me still? We see movies on Lifetime and some of the other TV stations where you always see this criminal that has changed the hair, cut the hair, make sure and grow out their mustache, done something different in an attempt to try to exactly put on a red dress, do very strange things in an attempt to try to fool your security, your bouncers, your white blood cells, your immune system, that it is not the person that you first recognize. And so when this here happens, the body has now noticed that there is a mutation that has occurred. Now, these mutations can be what we call point mutations, where they occur and they really don't make much of a difference. Clinically, they don't affect the overall picture of the virus. But then there are some mutations that can occur that certainly do cause a difference, either in terms of becoming more infectious. So when we first saw alpha, the alpha variant, the spike protein could be likened to an upper limb, and I'm now speaking very medically, an upper limb without an elbow and a wrist. So it was just straight, okay? And it would move and attempt to bind to the ACE receptor. However, with Delta, because of the actual mutation within the actual furin group, within the actual Delta virus of the spike protein, it now developed an elbow and a wrist. So it can pivot, it can move quite nicely, it can bind to several different sites. If it's not going straight ahead and it doesn't see something, it could just, flick to the left or flick to the right to be able to bind a lot easier. And that's why, for instance, Delta is more infectious. It can be transmitted a lot easier because even if it isn't, a little bit is in the space, it will get into the actual human cell. And once it gets into the human cell, it will replicate. And once it replicates, it can cause the disease to present itself.
Dr. Grandison, somebody
yes,
really want to ask you something before you move. I know this presentation, we want to get through it. This caller, can we give that caller a minute?
Sure, go
morning.
ahead.
Caller, go ahead.
Hi, good morning. Love your presentation. Really can understand it. But I had the vaccine, I had the booster shot on Sunday, and the caller before had said something about having bleeding after the vaccine. So when I got my booster on Monday, I had to catch the bus and stuff like that. And then when I was in the bus, my tummy started really cramping me. First, let me explain. I suffer from polycystic ovaries. So I take something called northisterone or
Northisterone?
Yes. And when I got into the minibus on my way home, I start to feel my tummy was really hurting, like if I was going to give birth to a child. And I'm saying to myself, what is going on here? Because I mean, I never experienced so much pain. Anyway, I got home, and good thing, by the time I get home, I was all messed up, and I had to run in the bath and stuff, and then that lasted about for 2 days with severe back pain. But this morning, no, when I got up again, it wasn't severe or anything, just see some spotting. So I'm just wondering, and plus two, I suffer from sickle cell, full sickle cell. There's a lot of things that are going on with me. So if you could give me a little advice or something.
Well, what I'm trying to do is try to explain probably why that occurred, because I think that for case-specific medical management, it is always best to sit down and go one-to-one with your doctor, because your doctor will have your full case history, okay? But I will explain to you very briefly why that probably occurred. Now, remember that this vaccine works by piquing your immune system, and it piques the immune system and it causes an inflammatory response. Not what we grew up knowing as inflammation or pus, but essentially causing the cells within our body to say something strange is happening. It's not really what it should be. There's something foreign in the space. We need to go investigate and find out, first of all, where is it happening in the body? And let's start to concentrate resources to make sure that this here doesn't get out of hand. Now, sometimes when that happens, a number of inflammatory cells are activated within the human body. And what that can cause for some persons are the universal signs of inflammation. In medicine, we talk about the dolor, the pain that one can have. You can also have the rubor. So if there is, for instance, if you get what we may call in Bajan terms a nail juk, you will get redness at the site of the nail juk. You will get pain, you will get swelling, you will get warmth. All of those are symptoms essentially in keeping with an inflammatory response, okay, or inflammation. Same thing can happen if it is that the body has recognized something foreign. So your body has recognized something foreign, and it is now causing lots of inflammatory cells to essentially be present in circulation to look for this bad guy. Where is it? Now, because of underlying conditions that you just made us aware of that you do have, that already can have your inflammatory system peaked, essentially, and it will cause an exacerbation of what you may experience because of your PCOS, for instance. You may get tummy cramps. Sometimes you may have an irregular cycle, but when it comes, it's then very heavy, or it doesn't always come to time. And it's because of that underlying inflammatory response that you can have, where now the vaccine has essentially peaked that response. So you're getting a more robust presentation of what you may have on a background daily level. What I would suggest to you is you can monitor it, especially given the fact that you do have sickle cell disease. certainly you should follow it with your doctor, especially if that cycle was now very, very heavy, to ensure that you have not moved from what your steady state or baseline is, to ensure that essentially you are safe. But I would say that you should go and see a medical practitioner, your medical practitioner that knows your full history.
Thank you so much, Dr. Grandison. We can continue now with where we left off, because we were talking about navigating the new variant, and it has more flexibility and how it finds its way to your vulnerable areas in your body.
So the variant, as I said, that arm on the spike essentially now can bind to the receptors that are in the space to be able to enter the cell a lot easier. Now, the other way that variants, when they mutate, they can either, as I said, they can cause one, increased transmissibility, because remember, the virus is trying to change to make itself better. So it can either become more transmissible, or what it can end up doing is attempt to evade vaccines. Now, that is the biggest concern that scientists have. Now, if you have the vaccine on board, because generally speaking, how your body works, you have two arms of your immune system. You have your innate immune system and you have your adaptive immune system. The innate immune system is just the normal patrol. Every single day, day in, day out, walking around, just, surveillance, ensuring that everything is good. May have, for instance, a baton on hand, but may not have a weapon that could really take down that criminal if it saw it. That was causing a major threat. However, when that threat comes into the space, it may radio back to the police station and say, guys, I can't handle this. My baton is of no use to me. You need to send out task force. You need to send out BDF. You need to send out the real troops, the real big guys, to really contain this situation. Now, certainly, if this situation that you have noticed with your baton as you were patrolling occurred down St. Lucie, and your task force is up in town, or your BDF is up at St. Anne's Fort, it's going to take some time for your real troopers to get down to the other side of the country. Same thing with your immune system. The immune system takes some while to be able to recognize what this foreign thing is and to be able to attack it and kill it and get it out of circulation. And that is the concern that we have with SARS-CoV-2, because SARS is not saying, okay, well, while you're trying to figure out what I am, I'm going to pause and wait for you to figure out who I am before I start to multiply. It's like, no, continue, take as much time trying to figure out who I am. I'm going to sit here and I'm going to multiply. I'm going to form some mutations of myself. I'm going to change my clothes, make sure I look sharp. I'm going to fool you that really and truthfully, you're looking for some person in a black shirt with the black pants, but I'm actually going to put some out there in circulation that has on a red dress. So at that point in time, you're completely confused. Your immune system is completely confused. And that delay in terms of being able to mount the responses where you have the problem. Whereas when you have the vaccine board, you would have essentially put up pictures in all over the country stating, look out for this criminal. So anytime you see this criminal, you can act on that criminal a lot faster, no matter how this criminal presents itself, because you are now primed to recognize the criminal. That is how the vaccine works. So there are no antibodies in circulation able to attack and kill and neutralize and get that criminal out of the actual space. Whereas before, when your immune system was not primed by the vaccine, eventually it will recognize it. So persons will say, you know what, I'm gonna eat healthy, which, by the way, all healthcare workers recommend that you eat healthy. We recommend that you get adequate rest, drink your adequate amounts of water, eat smart, don't use lots of sugars. All of these things we recommend, but the immune system still has to go through that period of sorting, trying to figure out what it is. Whereas when you have the vaccine on board, when you're immunized, your immune system has already known and been exposed to this foreign entity in terms of the spike. And now that you're seeing, for instance, not just sugar crystals circulating, going back to our tambourine ball analogy, you're now seeing the full tambourine ball walking down the street, if you could call it such. And now that this tambourine ball is walking down, you say, aha, I know those sugar crystals. You shouldn't be in here, and we are getting rid of you now. And that is really what the body does. This here was actually reflected in a study that was shown from a Singapore multicentral study, essentially, where they looked at persons who were vaccinated and unvaccinated and had essentially the same exposure and the same amount of virus in circulation at the time of exposure when they became infected. And what they saw is that persons who were infected and vaccinated started to have decreases in the amount of virus in circulation starting as early as day 4, and then going into what we call negative status by day 8. Whereas the person who was infected and got the virus all day 8, day 10, day 13, the virus was literally doing what it wanted to do because there was no restriction in place. There was nothing there to fight it, and it continued to multiply. Now, there comes a point in time, certainly when you have lots of virus in the system, that it will overwhelm all of your checks and balances that you have. And that is what we really don't want. So think about your vaccine as an additional layer of protection. When you think about it, you can certainly say, if it's almost like if you're driving down the road in some of the newer, nicer cars that are available, you have paratronics. You have assist, essentially, so that if something foreign or something that may be coming to harm your vehicle or your car, at least it beeps to allow you to know you shouldn't go there, or don't reverse anymore, or be careful when you go too close on the right. All of these things are modifications that help us to be safe. The vaccine is no different.
Mm-hmm. Do we have any information pertaining to why some persons would have a higher viral load than others? You know, you mentioned the whole scenario about the golf ball. Is it that I inhale half of a golf ball and you had the full one? I'm making it more harmful, spreading it more to all of me. You know, I'm just trying to figure out if we know anything about one person having more viral load in than the other.
So every person's exposure is going to be different. Certainly, if I had, let's say, SARS-CoV-2 infection and I had COVID and I was standing talking to you, Joyanne, and I was standing up talking to you without a mask, and we were talking for 20 minutes, you didn't have on a mask, and I continue to talk, and I'm now laughing, and then we get very upset and I start to shout at you, and we're in close quarters and there are no windows open. You are constantly inhaling all of that air and all the respiratory droplets that are coming out of my mouth. Certainly your exposure would be greater than if the two of us were standing on the outside. You had on your mask, I didn't have on a mask, and I was now whispering to you. And you could hardly hear me. I said, Adanna, talk up. And I'm saying, I don't want to talk hard. I don't want the virus to go too far.
You know, that happened to me yesterday. Somebody raised their voice and leaned over. We were in an open area, but they were a good way, but it came forward a little bit and then but I had on my mask. And I was like, no. And I was like, do you need to raise your voice? Literally. Because I know the more you raise your voice, the droplets. But I got to answer this question. You and I in a room, and one person allows air to either exit from the top or the below. Because we're talking now, we're talking about human air being released from the mouth or from the lower parts of your body that we all have to go through. Am I exposed to COVID?
So there's no evidence about flatus transmitting the virus. So if it's coming from below at this point in time, there is no evidence that's showing that. Mm-hmm. What we do know is that the virus and its sheddings can be present in feces, however. So that's why
that's why I'm confused, because if it's present in feces, I would like to think that it is present was passing out from below, including that of air. But no.
But we've not seen any evidence that's demonstrated that. In terms of a burp, that comes from not the respiratory tract, that's now coming from the stomach. Yes, you will get some mixing occurring when some of the air that's coming from within your lungs come out if the person is infected. But remember that a burp is really generated from your stomach. From the churning of the food, it produces gases and it comes up the stomach, comes up the esophagus, and out it comes. That's something a little different. So again, there really hasn't been much. What I have seen in the research hasn't really spoken very heavily on burping and flatus. But I can tell you definitely respiratory droplets interacting with either the nose, mouth, and eyes, because the eyes have a communication to the nose, right? You can have exposure.
All right, so let me see if I can understand. Because if I'm eating my food, it does not go down. You know, Bajans will say, you know, sometimes somebody cough and go, oh shoot, it has gone down the wrong hole. That's the first thing they say. But you eat it goes down to the esophagus, down into your stomach. All right, this is the question I have, but we got to take a commercial. But I want to know how it is that the droplet that goes into your mouth does not take the same route as the food if it goes into your mouth. But we got to take a break.
So we'll talk about that when we come back.
We'll come back. Welcome back to Face It and Fix It. Face It and Fix It. My apologies. I wanted to reach out to the callers before the end of the show. We are giving out some oximeters. Call us at 228-5563, 228-5562. Get a chance to speak to Dr. Grandison if you like, and you will hopefully get an oximeter. We have about 4 more we would like to give out. We might only have time for 2, but let's see how the time goes. Back to what we were saying, Dr. Grandison, and swallowing food, and it goes into the mouth, through the esophagus, into the stomach, and somebody talking to me and a golf ball land right into my mouth. I ain't swallowing that too?
So there are 2 different pathways for air. There's a different pathway for air versus food or drink. Okay. Right. So when we go into the back of the nose, as you often hear, the nose is connected to the back of the mouth. And if you look into your mouth, you can see your uvula, which is that little thing that's dangling in the back of your throat. Now, as you descend past the back of the tongue, the first area you're going to go into is at the level of the back of the mouth would be at the level of the pharynx. So you have your nasal and your oral pharynx, which is one to correspond to the nose and the one corresponding to the mouth. And then what happens is that at the level of the larynx, which is just a little further down, it then almost comes to a divide in the road. You either go forward, which would be into the airway or the respiratory tract, or you keep straight down, which would be into the stomach, going via the esophagus. Now, at the level of that larynx and pharynx, because we want to know how do you sort out air from food. And we often hear a person saying, oh, the food went down the wrong throat or the wrong hole, as you correctly stated. We have a little flap there known as the epiglottis. And what that does essentially is that it covers the respiratory tract or the airway when it detects there's food or drink coming down. So if something that is not air comes down into that tract, it essentially closes off to protect the respiratory tract and allow the food to slide on and go down the esophagus into the stomach. Now, what happens sometimes with some persons is that if you're eating very quickly and you're also inhaling, almost hoovering down food, sometimes the epiglottis doesn't shut as quickly, and you can get a little bit of those secretions starting to go down to the respiratory tract. The respiratory tract has recognized, oh, there's something that just came down here that shouldn't be in here, and it tries to beat it out via the mucociliary escalator, and then you cough. Okay? And that is what happens, and then the person says, oh, lost it went down the wrong throat. But certainly the respiratory tract and the airway is separate and distinct from the esophagus. So a person coughing or talking loud can generate respiratory droplets, whereas someone who's eating, they're just breathing, so they'll get respiratory droplets, but not the big juicy ones that sometimes would have hit you when you were at school, where we talk about golf balls, right? But you won't get those type of respiratory droplets being generated as you actually eat and as you swallow and it goes down into your stomach.
A question though. Okay, we have a caller. Good morning, Face It and Fix It. You are on the air.
Good morning. I am a person that is frightened for injections. And when I went to get my injection, good morning. I am a person that is frightened for injections. And when I went to get my stick, I was so frightened. The nurse told me just sit down, relax. And when I relaxed, when I hold up for ice, she said, get out the chair, it done everything. You got to give complimentary to the nurses because you're getting them more better than to me like when you go to the clinic.
I do have to compliment you simply because I know this here would have been quite a significant event for you. You would have been quite concerned, but you braved it and you still went and you got your vaccine. And yes, the vaccination is actually given with a very, very tiny needle. And remember that the tip of the needle is extremely sharp. So most persons won't feel when that needle, especially with the technique that we are trained as physicians and nurses to actually administer that vaccine, you won't feel even when that needle goes into the skin, okay? Because there's essentially no drag, no friction between the skin and the actual needle because it pierces it quite nicely.
Is that thin? And that, when we say sharp, we don't mean like, stab sharp, but sharp enough and thin enough, especially if you got arms like mine. I really did not feel. I had all kind of layers of whatever. It just went right in and I did not know. But this brings me to a point when we talk about fear. And even though as a doctor, the fear factor plays a major part in a person's ability to heal. And we've seen a lot of fake news about the vaccine and what it does to create fear. However, you could also look on the other side that people are saying that people who believe in the vaccine, they're also creating fear. So let's just say both sides, somehow there's a level of fear. But getting the information, the right information, and being able to process that. Everybody, if you're human, you can be scared. I going for a booster today with my daughter Sky. My heart's still beating a little bit, but I know I'm going to do the right thing. But hey, we're human. You feel a little anxiety. But when people catch COVID or people who are getting the vaccine and fear steps in, how much of a big of a part that plays in terms of even healing, in terms of your breathing, in terms of getting back to where you need to get back mentally? I know you're not a psychologist, a psychiatrist, etc. But a lot of people are saying fear is playing a major role in some of these deaths or people who are not bouncing back fast enough, even if they're vaccinated. How big of a problem is it?
I think that the psychology behind illness is significant, not just for COVID, for any disease process. But I will say, conversely, that the biggest reducer, if I could say, of fear is to educate oneself. And there are times, as you correctly said, being fearful is a natural response. I'm a physician and there are things that I am scared of. However, when I get scared, that is a signal to me, Adanna, you are not as comfortable with this information as you should be. And it causes me to dig, to go find out exactly what is the real truth behind it. And when we think about scientific data, there is a particular way that scientific data is presented. Scientists are not the nicest to each other, I would say that from a publication standpoint. When we look at data, yes, you can have associations, things that you've observed and stuff like that. You may write it down, document it, you may post it in a journal, but it is then in that peer review process where another scientist gets to look at it, gets to dissect it, gets to essentially pick it apart and say, oh, you have some errors in your thinking here. And this is where we as a community of scientists really benefit from each other, because once you have that peer review process, you can then ensure that the data that is coming out has been ventilated quite widely, has been assessed by many persons, and what you have put into this space, the community, the scientific community, is now factual. It's not based on a bias that you may have. It doesn't have these little associations that you must say, well, let me just ease this one in here and hope that nobody has recognized, because somebody is going to pick it up. And that's why science is so exact. We need evidence. That evidence needs to be substantiated. It needs to go through the test of time of several persons looking at it. Sometimes they may even recreate your study to see if what you observe is what they observe. Was it seen in the same type of persons, same race of persons, persons with the same background, clinical situation? And then once we get that data that comes out, that peer-reviewed data, we can say, okay, this is credible information, I can take that. And that is where you will often hear scientists and doctors speaking about accessing peer-reviewed information, because we know it has stood the test of time.
And that's why we're gonna take this caller because we're running out of time soon. Caller, good morning.
Good morning, John. How are you?
I'm well, and you?
I'm fine.
Good.
I have a concern now. Number one, I have a friend who has taken the first dose and about to take the second dose, but I think that she's not feeling well, and she thinks that she is coming down with COVID. So she go ahead and take the next vaccine, or should she wait? Because they may be concerned about taking the vaccine and having COVID. How would it affect the body?
All right. Don't hang up yet, caller. Respond.
That's a very, very good question. If you are exhibiting symptoms in keeping with COVID, all those symptoms that I just spoke about, okay, then I would say to your friend, she needs to get tested. That's the first thing. If she's not feeling well, she needs to know her status. There is nothing wrong with knowing your status, and a lot of persons in Barbados, I find, we have unfortunately stigmatized COVID. It's a respiratory illness. It's nothing to be embarrassed about. It's nothing to shun or scorn any of your family or friends about. It's something that anyone can contract quite easily, okay? So the first thing I say is that she needs to get tested. After she's gotten tested, if she is not COVID positive, she may have another illness. And generally, we do not vaccinate persons who may have, for instance, an illness that's presenting with fever. So if a person is acutely ill, we want to wait until they're back to baseline and then for them to get vaccinated, because the immune system, remember, is there in the background working, which is actually causing probably the majority of times the person to feel unwell. But I will definitely say that the first thing she needs to do is to get tested. She needs to know her status.
Is that, because I said number one, is there another question, caller? Okay,
right. I don't have the symptoms.
Say again?
What if the person is asymptomatic? They don't have any symptoms. They go ahead and take the vaccine. But then a couple of days or so after, they had a test and they're positive. How is
That
it
has
going to
happened.
affect the body?
So remember that the vaccine does not have in the virus. AstraZeneca only has in the information for the spike. It does not have in the virus. So you cannot contract the virus from the vaccine. The Sinopharm vaccine has in the dead virus. Okay, so that cannot replicate and cause you to get ill from or get the virus. The Pfizer vaccine has in the messenger RNA, which is the code behind, again, the spike, which is only the sugar crystal, not the full tamarind ball, so not the virus. So you can't get the virus from the vaccine. But remember that there's something called an incubation period, which is the time between you are exposed and the time when you present with symptoms or you can test positive for the virus. Okay, so this person may have been exposed and be asymptomatic. I thought that you said that she was feeling unwell, so yes, she can go and get tests. But even if she's not feeling unwell, there's that period of time in between when you can be exposed and when you can get a positive test in terms of without any symptoms. And I would definitely say for any person who is feeling unwell, get tested. But I can also tell you equally that getting the vaccine does not cause SARS-CoV-2 infection that results in COVID-19 disease.
Oh, okay. We have another caller, but of course I want to ask a question too. But the in between catching it between 1 and 2, and how soon do you get the second one? But we'll take this call first. Good morning. You are on the air.
Hi, good morning. I'm currently due for my booster shot this month, but right now I'm in isolation. So I wanted to know when will be a good time to get the booster shot after this.
Good question.
So I
You're
think
vaccinated fully? You're vaccinated fully?
Yes.
Okay. May I ask you, first of all, thank you for calling, but how are you feeling?
I'm great.
Good.
Fine.
Good.
Yeah.
Which goes to show being vaccinated, even though there are breakthroughs, the vaccine is doing what it's supposed to do. So, Dr. Grandison, any words for how soon after COVID, and then the in-between shots, if you catch it between the first and the second?
I would almost say she stole your question.
She did. She did. Yeah, but let's take a break. I think producer wants me to take a break, and then we can come back to the answer. Let's take a break.
Okay.
Welcome back to Face It and Fix It. Before the break, we were talking about the time frame that we need between the first vaccine and the second vaccine if you catch COVID in between, as well as if you caught COVID after you're fully vaccinated, how soon can you get the booster? Dr. Grandison?
Question that the caller would have asked first, which is she's had her full course of her two shots. She has been infected with SARS-CoV-2. She's developed COVID, and as she just stated, she's doing well. So she probably had a mild presentation of illness. In a situation like that, there's no recommended delay for some person after getting infected with COVID to present for a booster. Okay, so once she is cleared clinically by the doctors within the program, she can proceed, provided that the 6-month period has passed where she would have originally gotten the booster. Had she not contracted COVID, she can go ahead and get her booster shot.
Okay.
In terms of persons, the scenario that you would have asked, where the person has gotten shot 1 of their 2-shot course, they've gotten COVID in between, they should maintain the schedule of their second shot. Okay? Now, there are persons who would, the newest set of data is showing persons who are asymptomatic and have gotten COVID even before getting a vaccine. If they're symptomatic, they wait the 3-month period. If they're asymptomatic, they wait 1 month before they actually, to allow the immune system to quiet a little bit, and before they are immunized. Now, the only persons, and this is not really within the context of Barbados, that we recommend a person delaying getting the shot is those persons who would have received monoclonal antibody therapy. That is not happening here in Barbados. So those persons, that's more in the US context, where persons are getting that type of therapy, because again, the immune system is a little weakened. It's not as resilient as we would want it to be.
You want to break down that term so that I don't bite my tongue? Because I'm sorry. It sounds like something pretty dangerous, or at the very least contagious.
No. So essentially,
anything mono, I'm worried about. So go ahead.
No. So essentially, there are different treatment modalities when we look at the armamentarium for fighting COVID-19 disease.
Okay. Oh, okay. Go ahead, because we have a caller, but finish, and then we can take this quick call. Go ahead.
Sure. We can use, in the international context, they can use monoclonal antibodies, which is just really to help you get through it. There's the plasma transfers, which we saw were being used early on. Persons have used steroids. Certain facilities have used things like remdesivir. We're now seeing molnupiravir coming onto the market by Merck, Pavloxed, all of these different things that little goodies in the bag to try to assist with helping a patient get over severe COVID. Now, if a person uses the monoclonal antibodies, what it does is that it sort of dampens the immune system. So this person would essentially not have as strong an immune system. So we want to give them enough time to essentially recuperate, and then we would allow for them to get vaccinated. But that's not happening here.
Okay, we're going to take this, hopefully, last caller maybe. We'll see if we can get through another one. But Face It and Fix It, you are on the air. Good morning.
Leslie, good morning.
Good morning.
Good morning.
Leslie, good morning to you, Ms. Haigh, and Dr. Grandison. I must say her scenario on the tambourine ball was very educational, and she puts it that any simple person could understand. I must say that I had my first dose, and it's due for my second one, and I would encourage anybody and everyone to go and get their vaccine, because I tell you something, we don't know what's going to happen, and it's very encouraging. I always look at people and say, I don't care what anybody say about is of the devil and that's it. I'm not saying that. I strongly believe in the Bible, and I went and I take my dose, and I'm due for my second one, and I'm going to take it with pride. And I encourage everyone to go there and have their shot. I must see, when I looked and I saw your faces on the screen, you're very pleasant. And you must say, God bless you, and keep up the good work.
Thank you so much.
Thank you very much.
Thank you. So, Dr. Grandison, I can put you on the spot here now publicly. That presentation was so good. The Ministry of Education is about to roll out a campaign to increase the vaccinations for children between 12 and 17. And it starts next week, and they need some help. But the way you told that story, that the only reason that we had to break for commercials that you gotta go get. I wanted popcorn. I wanted, because I'm sitting down here going, so where are we going with this next? And then what happened with the bedroom and the analogies and how you pull everything together. I think it's something that the ministry can use, explaining for the parents who have to help make a decision. Now, because parents have made the decision for themselves, some of them on the fence about their children. For me, if I can make a decision to vaccinate, I should be confident to do the same for my children, but to each his own. But the story, the way the presentation was done, I'm sure Sky, when I get home, is going to go over that with me, and I'm sure she's grasped most of it. And as people know, my daughter is mentally challenged, so it means that any person and any layer of understanding here should be able to get it. So can I hold you to that, and maybe we'll call you and make sure we can video that, or permission to maybe even package this and without the commercial breaks, and we can give it to the ministry. So we have your permission to do so. So we do have one or two more questions that I wanted to ask you quickly. We know you're in charge of home isolation. How is that going? We know the numbers are going up. Can you tell me if you released from the time start? I mean, can I hear like 1,000 people home by tomorrow, or how is that going?
So since the program has started, because sometimes when we are providing data, we focus sometimes on the amount of persons infected, the amount of persons in isolation, but we never really focus on the good news, really, the amount of persons discharged. And I think that's important. And so from the 30th of September to today, our discharge total is 3,858 persons. And we will probably have a lot more. Dr. Brian Charles is the person who works quite closely with the discharge process. We will probably have a lot more. That's why he left quite quickly, because it's really a full-time intervention that one has to dedicate to such. We did have, go ahead.
I was asking a quarantine now. How many people in quarantine, roughly? That's isolation. Do we have numbers for quarantine, home quarantine, waiting to?
So we don't have the quarantine numbers because that side of the program is really managed at this point in time by the polyclinics very heavily. So as they filter back in that data, we do get updated. There are a number of primary contacts because of the amount of positive isolated patients we have who are automatically in quarantine. Now, I will say to persons who are in quarantine, however, that it is important that they too ensure to follow the protocols. And why do I say this? It's quite easy if you're staying in the home of some person, a loved one especially, to drop your guard, to not want to wear your mask, because after all, that's my loved one. I don't need to put on a mask when I'm talking to him or her, or my little loved one, my daughter, my son, or even a grandchild. We know that grandparents tend to get quite weak when they think about their little bambinos. However, remember that at that point in time when the person is in isolation, they can be infectious, they can spread the disease. And for persons who may have underlying illness, comorbidities, hypertension, diabetes, two of our biggest challenges here in Barbados, obesity, chronic kidney disease, respiratory illness like asthma or COPD, all of these are things.
Including people who have varicose veins or fear of clotting, etc., that we talked about earlier, the person who does not want to her mind is not there as yet. I'm hoping to convince her. I'm looking into the screen because I know she's watching. We have a WhatsApp message, and I pray we don't go over because we can't go over the time. We're going to put that WhatsApp message on the screen. Good morning. I have not heard any conversation about the virus and the sea. Sea bathers who are not wearing masks and not physical distancing and in conversation with each other. What is the percentage of virus spreading rate among sea bathers? Anything on that?
I have not seen any research coming up about that. However, I can tell you what I do. Whether I am in the sea or I'm on land, I think it is important that you exercise social distancing. Okay? Certainly, anytime that you are talking, you're having any conversations with anyone, there is always the possibility, if you are infected, that you can spread. Do you always know if you're infected? The answer to that is no. So the safe thing to do is to just maintain the distance. You could talk, but you're open air. By the time you talk and there's a lot of distance between you, the virus has been swept away, and you keep everybody safe. And I think these are some of the very easy measures that we can take if we are not yet decided on that vaccine. I hope that this morning, with the additional information, you are a bit more informed about why Vaccinate, how COVID and SARS-CoV-2 works in terms of why it really needs us and why we need to disrupt the spread of SARS-CoV-2 virus, because it's so important. The virus cannot survive without us. It needs us more than we need it. And right now we don't need it at all. We would like to go back to our normal baseline activities if possible.
I have some WhatsApps here on my phone, and I can tell you that there are people messaging me. They didn't tell me what the question was. In some cases, they said, girl, when I answer my question, I'm going to get my booster. Because I believe a lot of people were on the fence about what to do. I know I know I called you, and I didn't know. Not that I wanted information as if to boost. I know I had to. I just wanted information as to which one should I go on. In 2 minutes, because I think we're taking you right up to the end, because I don't think there's a commercial break, but the producer will tell me. The antiviral drug, the one that's out in the UK, you pronounced the name earlier. I'm not going to try, but you can tell me, where are we? How soon do you see that coming? Because I know you're excited about it. It's out there. It's a game changer, possibly.
Yeah, so this
40 seconds. Go ahead.
You're talking about molnupiravir.
Yes.
This is one of the game changer drugs that's out there. We haven't gotten our clearances for it. I'm hoping that we can get it quite soon, because what it really does is, instead of allowing for the virus to replicate itself and produce another one that looks like itself, it essentially puts all the seeds on the outside, puts the sugar on the inside, and gives no flesh. So you don't have a nice looking tambourine ball, essentially.
Fair enough.
So it can't continue its job.
All right, we're going to have to end on that note. Dr.Adanna Grandison, she is Consultant Manager of Home Quarantine and member of the Isolation and Home Quarantine Committee. I want to thank my viewers, callers. I hope you got the information for the oximeters. I hope you left your name and number so we can get the oximeters to you. Thank you so much for taking the time to come. Thank you, Adanna. We'll see you again soon. Thank you. We'll be back on Monday. I hope you join us then. God willing, we'll be back. Stay safe. Goodbye.